Good evening, and welcome to BlackDoctor.org's inaugural Facebook Live in a series called The Vaccine Rollout: When, Where, and How. This series takes the national discussion on the COVID vaccine rollout and makes it local. We will focus on the top metropolitan areas for Black Americans and give them up-to-date information on when, where, and how they can get the vaccine. Tonight, we are focusing on Chicago. The vaccine rollout has begun across the country, and the reports on the results have been mixed. According to the CDC, there have been over 73 million doses delivered, with 41 million receiving one dose and over 16 million receiving two doses. These gross numbers may seem promising. However, upon closer inspection, only 6.3% of African Americans have received one dose, and even fewer, 5.6%, have had two. The vaccines for Black Americans are trending below our population levels, while the infections and deaths are trending above. There are several reasons for this, but we know that a significant number of Blacks want to get the vaccine. This series is dedicated to getting the information they need to be vaccinated. Our guests this evening are going to tell us when, where, and how you can do this in the Chicago metropolitan area. Let's get started. Our first guest is a video interview with Dr. Marcella Nunes Smith. She is the chair of the Biden Task Force on Health Equity and lead of the Biden-Harris COVID-19 Transition Team. She is going to provide some important updates about the national effort to controlling COVID-19. She is being interviewed by video editor Jade Curtis.
Hi, Dr. Nunes Smith, and thank you so much for joining me today. How are you?
I'm doing really well. How are you?
I'm pretty good. So as the lead of the Biden-Harris COVID-19 Transition Team, can you give us a quick update or a weekly update about COVID-19?
Absolutely, it'd be my pleasure, and thank you so much for having me here today. It is a humbling honor for me to serve as the inaugural chair for the Biden-Harris administration COVID-19 Health Equity Task Force, and we're getting going with that work. I'm also part of the White House COVID response team, and we've begun our work from during transition, and there's just lots of great news coming out of the White House team. We have really ramped up the supply of vaccine that's out there, and every day we're averaging, about 1.7 million folks getting vaccinated in our country. So that's just really tremendous news. As we look out on the forecast, supply is going to continue to increase, which is great. So we want to make sure that when it's your turn for vaccine and you are at yes, that we can connect you with vaccine easily. The vaccines are free. That's really important to know. And we're making sure they're accessible.
Absolutely. So a lot of people are curious if they've already tested positive for COVID-19, do they still have to get the vaccine? And if so, is there a certain amount of time that you need to wait to get the vaccine?
So great question. We get this all the time, kind of. So, I've already had COVID-19, the vaccines aren't for me, right? But the reality is, if you've had COVID and you ask the question, do I need to get vaccine? The answer is yes, right? Absolutely. So there's some evidence that if you've had COVID-19, you can get a little bit of potential protection moving forward, but it's really inconsistent how strong that protection is or even how long it might last. Reinfection with COVID-19 is possible, particularly as we all know we're dealing with variants and other things. And that reinfection could be severe. It could be more severe than the first time you had COVID. So it's strongly recommended from the CDC and others that even if you've already had COVID-19, you still get the COVID-19 vaccine. Really important question about how long should you wait to do it? So the reality is while you're still feeling sick or symptomatic, you really shouldn't. But the CDC recommends waiting up to 90 days to be able to get the vaccine, partly because we think that natural immunity you talked about does last that long. and allows for kind of other folks to get in queue and get their vaccine. So, think about it around, like, set that appointment for just around 3 months after to get that vaccine, but so important to still get vaccinated.
Gotcha. So is there any expectation on how long the vaccine will last? Is it projected to be an annual vaccination, or just what does the vaccine look like in the long run?
Yeah, just another really great question. This is what we call sort of durability of the immune response, right? So when you get the vaccination, how long will your body kind of remember so that it can launch a full scale attack should it get exposed to that virus again? Now, I think people will be aware, like this, there's a lot that we can remark on as far as the scientific discovery getting us to where we are now. What it means is that we're still in that process of data collection to understand exactly how long that durability will be. The good news is that the clinical trials that tested the vaccine, they're coming up on their anniversaries of 1 year. So we'll be able to look at those participants and answer that question definitively. We do think about things like influenza and the flu, where we do have to get regular sort of repeat immunizations. And so it's reasonable to think that that might be where we're headed with SARS-CoV-2, which is the virus that causes COVID-19. But some of the earliest indications suggest that there might be immunity for, around a year. But again, this is real-time data gathering. Just know that all of that work is being really done so we can get those definitive answers. It still remains that getting vaccinated is the best way to keep not just yourself safe, but really your family and our community.
Definitely. So one of the things I was actually kind of curious about is, will the vaccines be effective for some of the newer strains? Because we've had a lot of new strains pop up in the last couple of months. So what does the vaccine look like with some of those newer strains?
Great questions. We are seeing these new strains. Sometimes we refer to them as variants. This is exactly what viruses do. So I want to be clear about that. This is what every virus always does, is tries to figure out ways to mutate, right? To spread itself more effectively. So that's what we're seeing happening. And really importantly, one of the ways you stop the emergence of new variants is by getting everybody vaccinated. So I want to be sure to link those ideas together. The faster and the more people who get vaccinated, the fewer new variants we'll see. So where are we now with the two vaccines that have been authorized? That's the Pfizer and the Moderna. There is some early research there that says those vaccines can still be really effective against those variants that were first identified in the UK and South Africa. So some sort of guarded optimism there. They're also looking at creating booster shots, if needed, to improve protection against, those variants or really any of the other variants. But the takeaway is, everything that we have right now says that it's still safer, more effective to get vaccinated, even against these new variants. Best way that we have to protect ourselves, in addition to, of course, wearing our masks, our hand washing, and still maintaining some physical distancing.
So you mentioned the two different types of vaccines, and now that there's a third, could you explain the differences in the different types of vaccines?
Yeah, great. So, everyone is becoming kind of an armchair vaccine expert now, because we need to. And these are really good questions to ask, kind of what's the difference between the different vaccines that are available. So at this moment, right now we have two vaccines that are authorized by the Food and Drug Administration. That's important. That's the Pfizer and the Moderna vaccines. Both of those are what we call mRNA vaccines, or messenger RNA vaccines. And both of those work in really the exact same way. Now, what we have is hope for a third and maybe even more vaccine, but the Johnson & Johnson vaccine product is getting reviewed right now by the FDA. It's not been authorized yet. Now that does work a little bit differently. So that's what we call a viral vector vaccine. That type of vaccine uses harmless, let me emphasize harmless, adenovirus, just a type of virus, to transport the material, the genetic material for that outside area called the spike protein of the coronavirus. So it's, we're going to see vaccines that work a little bit differently, but still are safe and still are effective. Just a reminder, Pfizer and Moderna, really almost identical in terms of efficacy as well as action. Around 95% symptomatic cases for Pfizer prevented, 94% for Moderna. I just want to flag for everybody as you start hearing different numbers for different vaccines and what does it mean, that we try to do apples to apples when we can. With the Johnson and Johnson vaccine, their outcome was a little bit different. So in that case, it wasn't symptomatic cases. We're talking about severe cases. And that product seems to prevent 85% of those severe cases. These are incredible numbers. Starting out looking at these vaccine developments, we were going to be really happy with anything with more than 50% efficacy. And so to be in this space talking about kind of 70s and 80s and 90s is very, very remarkable. Just one last point. Moderna and Pfizer, those both require 2 doses, something called a priming dose and a booster shot. 28 days between your shots for Moderna, 21 between them for Pfizer. But Johnson and Johnson vaccine requires only 1 dose. So the last important distinction potentially for some folks.
So one of the things that a lot of people want to know as well is, while we're working so hard to get everyone vaccinated, once they do get vaccinated, and as you mentioned, some people get 2, some people would just need 1 if they get the Johnson and Johnson. What can they do afterwards? Do they still have to wear a mask? Do they still have to social distance? Or can they go back to normal?
Yeah, that's so great. So I often talk about, we all need to get vaccinated so we can get to our new normal, right? I think it's really important. This is a key question as we kind of have all these conversations around science and vaccines, but people really just kind of miss their lives, right? And so how can the vaccination really help us all reclaim our joy, right? I think that's where we're looking at. And people are missing, right, opportunities to go maybe to sporting events, to go to church and faith communities, right, or to see other loved ones. And so it's going to be really important to make sure everybody has a clear sense of all the things that we say are safe. The CDC is working on guidance now, but absolutely the idea is that you can begin, particularly with others who have been vaccinated, begin to create some of those memories that we've all been missing. I talk to my children about how this next Christmas being able, which is what we celebrate, being able to see grandparents right after everyone's been vaccinated. So important to keep our eye on what that prize can be and what that prize looks like. To speak for a second about mask wearing, which is so important. So one of the things that we know, or what we know for sure, is that the vaccinations can reduce the severity, and that's what we're trying to do. We don't want people to go to the hospital. We certainly don't want people to lose their lives over COVID-19. So the vaccination prevents that. One of the scientific questions still out there is, does the vaccination keep you from spreading it to other people? And so that's ongoing now. And so that's why we continue to say wear that mask, even if you've been vaccinated, right? First of all, think about other folks around who haven't been vaccinated yet. You don't want to pass on to them. Also, no vaccine is 100%. So even while we're going through this period of everybody getting vaccinated, it keeps you safe still to wear your mask. But, other than that, I tell people all the time, the mask is my friend. I don't think we should be at war with our mask, but thinking about some of these other activities that we can start doing again and do more safely, that's the long game for sure.
Absolutely. Well, Dr. Nunez, once again, thank you so much for joining us. I appreciate you sharing all this information with us and just being a part of our platform. So thank you once again.
Thank you.
Let's try that again. And that was Dr. Marcella Nunes Smith she is the lead on the Health Equity Task Force with the Biden administration. And so she is really on top of what's going on with the vaccine and the rollout. And that's what we're here to discuss today. And so we're talking about Chicago. And we can't talk about Chicago and anything medical in Chicago without going directly to the medical director for the city of Chicago. And so we are so happy to have Dr. Candace Robinson, who is the medical director for the Chicago Department of Public Health. So I'd like to bring her on, and thank you for joining us this evening, Dr. Robinson.
Thank you for having me.
Well, great. And so in your role as medical director, would you say What would you say is your primary objective when it comes to dealing with COVID-19 in Chicago?
Well, I'd say our primary objective is really to save lives. We really want to make sure that we help people get the information and resources they need so that they can navigate this pandemic, they can keep themselves and their families safe. And at the end of the day, we want people to stay safe until we get and utilize all the tools we can to get out of the pandemic.
Absolutely. So what steps is your department taking to ensure that you reach that objective of saving lives?
Yeah, I think we're doing things on multiple fronts. We have mass media and marketing campaigns to ensure that everybody has kind of the most up-to-date information, resources they need for that. Working with our hospitals and our providers, specifically currently, the main thing is on the vaccine rollout and on vaccination with the COVID-19 vaccine. And we're
Right.
working with our community partners really so that we can hear the concerns of the community, get out information about the vaccine, address vaccine hesitancy, and get facts out about this vaccine.
Well, I know I'm sure you're familiar with some of the headlines. I mean, even today there was an article I believe it was in the Chicago Tribune about people getting vaccines in areas that's not designated for them. Specifically, we have in the south and west side of Chicago is more predominantly minority communities, and they're saying that the article is suggesting that people from the north and east are coming into those communities and getting vaccinated, and so that has led to depressed numbers of minorities and Black and brown people specifically getting vaccinated. What do you think the city, well, how do you respond to these reports, and is the city doing anything to try to help stop some of that what's been called line jumping?
Yeah, certainly. I think overall, racial equity is the driving force behind our COVID-19 vaccine plans here at the city. Equity is just not part of our strategy. Equity is our strategy. And so we're really working to make sure that we get vaccine into the community. One of the things we have undertaken here in Chicago is what we call Protect Chicago Plus, where we have identified 15 of the hardest hit communities by COVID-19. And are kind of targeting those communities for vaccine and vaccinations for members in those communities. So taking vaccine to the community and working with local organizations to set up events that are really meant just for the community members and access for those community members to attend those events, target vaccine to those who have really been hit the hardest, and to try to prevent some of the people from coming into the community to access those vaccination services.
So it sounds like, are you saying is it a combination of getting more information out there to the community so they know what to do and how to get the vaccine, and then as well as having more availability in community areas so Blacks can go to them, that they feel more comfortable in getting that vaccine and going in there. So I think it seems like there's a combination of things going on to really try to increase the number of Black Americans getting the vaccine.
Yeah, absolutely, 100%. It's a combination of factors. Like you said, getting vaccine in the community, removing any and all barriers to vaccination for members of the community who, have been most impacted by COVID-19. And then also, like you said, getting the information out there, making sure people are informed. So when it is their turn and when they do have the opportunity to be vaccinated, they're ready to be vaccinated and get that protection for themselves.
So here's a question: if somebody wanted to get the vaccine in the Chicago area, how would they go about doing it? Is it do they have to register with a site? Can they just go to a location and register? How do they go about getting registered and getting vaccinated?
Yeah, so I think there are a couple of things you can do. First, you can check with your provider to see if they have COVID-19 vaccine, so that you can access it where you normally would get vaccinated, your provider, your pharmacy, et cetera. I think another important first is to figure out where you are in line. And so we are progressing through vaccination, and different people are recommended for vaccination at different times based on their risk for exposure or their risk for disease. So figure out where you are in line, and then when it's your turn, make sure you contact your provider. Another thing you can do is go to ZocDoc. The city has partnered with ZocDoc as an appointment scheduling tool to help. And so you can find information on available appointments across the city, and it will notify you when new appointments become available as well. And so another place to get information, the Chicago Department of Public Health website, chicago.gov/COVID vax will always be updated with the most recent information you need about the vaccine.
Okay, that's great. So, how important is it for you and your department to get people vaccinated as quickly as possible?
I think that's, the most important thing right now. That's our top priority, really combining getting the vaccine out as efficiently and as equitably as possible. To date, we've provided over 500,000 vaccines here in Chicago. 1 in 10 Chicagoans are now vaccinated here in the city, and 1 in 4 Chicagoans over the age of 65. And so getting this vaccine out quickly and effectively, this is one of the main tools we have to get us out of this pandemic. And it's the light at the end of a long COVID tunnel. And so this has been our top priority.
No, it's been on if you're in the medical profession, whatever level, it's part of what you're thinking about at all times. It does not matter. And I noticed that the mayor released today about health equity, and so it seems that the city is trying to do what it can to make sure that those levels get evened out. Because I mentioned in my opening statement that while Blacks represent 12% of the total population in the country, 12 to 13%, we are lower in terms of total vaccinations, and so we're underrepresented. So we've got to do what we can do, and that's why we're having these type of panels. And I see that the mayor is on board with trying to ensure that African Americans and Black Americans in the city of Chicago are getting vaccinated.
Yes, absolutely. That's been one of our primary focuses, and we've made great strides in that, as you heard from the announcement from the mayor earlier. This past week, approximately 50% of our vaccine went to minorities here in Chicago, and so we are working to increase the access and in vaccination in our minority communities and in our populations that have really just been hit hard by COVID-19.
Absolutely. So I'm going to get on to some of our other guests, but if you don't mind, if you could stick around for a little bit, we'd like to have a little short Q&A session at the end of our broadcast. Because I know that I see some questions here in the comments section, and I know we want to get as much information to people and get their questions answered. And I know we won't be able to answer them all. So I'm telling everybody now, we're not going to be able to answer them all, but we are going to try to get some questions. And we've got, while we have Dr. Robinson here with us, we'd like to get those questions, at least a few of them asked, so we can get answers for you. So if you hang around and enjoy the rest of the broadcast, and we'll talk to you later, Dr. Robinson. Well, next we have Dr. Toyin Falusi, and she is an infectious disease physician here in the Chicago area. She's no stranger to Black Doctor. She appeared on our Straight Facts broadcast in the fall. A lot has happened since we did that broadcast. At that time, the vaccine hadn't even been approved and hadn't been rolled out. So now a lot has happened. So we are here, and we'd like to really kind of get an update with her. Dr.
Hi, how are you?
I'm doing great. How are you? I haven't seen you in a while.
I know, busy but good. Thank you for having me. Yes.
Yeah, so I'll say this. One of your most memorable lines during our first interview was, "Vaccines don't work, vaccinations do." And since then, what have you been doing to ensure people are getting that message?
Wow. Yeah. So, we like to say, thank you so much. We like to say, in medicine, people say, what's the best medicine for XYZ? We say, well, the one the patient actually takes, right? And so, at the time when we talked, we were talking about these vaccines were about to get approved or to be presented to the FDA for EUA. And we said, we really have to do kind of what is going on with BlackDoctor.org and other organizations to start to get from vaccines in the freezer to the arms of the people who need them, and that implementation part. And obviously since then, just listening and knowing what's been going on in Chicago and in the state and across the country, where we're now doing about 1.7 million vaccinations a day, is really because of a lot of work that's gone into moving from vaccines in the freezer to the people who actually need it. And so some of the things we're doing is just continuing to talk about it, really talking about vaccine hesitancy, acknowledging that people have concerns, really giving them information in a way that they can make informed decisions, really sharing experiences. And, so when I got vaccinated, I went on, I talked about what it felt like, why people should do it. And so I think, and I've written about it, I've done a couple of blogs, I've done a podcast, just really sharing my experience and also really figuring out what are the reasons where people have concerns, what are they worried about, and really addressing that. I've done stuff with churches, I've done stuff with different organizations, small organizations, larger ones, smaller groups, just really talking about the science around the vaccines, but acknowledging that if people are not comfortable with the science and how it's presented, if they're not comfortable with who is doing the presenting, if there's no trust in the process, we're not going to get there. So that's really what I've been doing, sharing my experience, talking about it, listening, and figuring out how we can do a better job between the science and the scientists and the people who need the vaccination.
So that's phenomenal. And I'm so glad that you're there on the front lines of really trying to get education out to people and get people more motivated, get them information. And I'm going to say that specifically because what we've been doing here at Black Doctor is really giving people the information that they
information.
And information, and then they can use that information to make whatever decision they want to make about the vaccine. But we're trying to get them the most up-to-date and current and factual information to kind of counteract what's going on out there on the web. So
yeah.
I'm kind of curious, like vaccines are such a regular part of our lives in America.
Right.
Why do you think there's been such resistance with this particular vaccine?
So you're correct. So vaccine has, and not just in America, around the world. The last time I did something was in a panel in the UK. It was a large church in the UK that had lots of members and branches. And really, they found the same thing. This was in the UK, among different communities, they had 40 to 50% vaccine hesitancy, or people saying, I'm going to wait, I'm not going to do that. So it's not just in the US. And the World Health Organization has listed vaccine hesitancy as one of the top 10 threats to public health in the world. So it's why this vaccine, like you said, vaccines are things we've used. We vaccinate our children. We do all this for school boosters, for tetanus. We've done that. But I think for a couple of reasons. One was the fact that we're used to vaccine development taking a long time. I mean, usually years, sometimes longer than decades, where the earliest vaccine, I think, prior to this it took about 4 years, right? And so because it seems like it was fast, that is something that people have had concerns about. And when you talk to the people, and you've had people on your show who are part of the vaccine development process, they will tell you, we've been working on this technology for a long time. Right. mRNA technology has been around since the 90s. It was refined in the mid-2000s. And then with this process accelerated, they've been studying coronaviruses since, again, the 2000s, after, the outbreak of SARS, after MERS. So, knowing a little bit about the coronavirus ahead of time, not this particular one, but working on it, working on the mRNA technology. And then you get to a point where you have funding. It's the single biggest problem that we're working on. You had research participants. So things moved faster than the usual, but there were no shortcuts. People were worried about shortcuts. There were no shortcuts. The process was, because all the funding, the science, everybody was working together on the same process. People have worried about, what about, we don't know about the long-term side effects. Well, if you think about it, the first cases of coronavirus 19 were discovered, talked about December of 2019. So here we are a little over a year. We already have a vaccine. Yes, we don't know the longer term side effects, but what we know about the mRNA technology and how that works, and what we know about how it works within the body, there is still going to be ongoing follow-up. But what we know now is that we need to get antibodies, we need to get protected, and there will be ongoing follow-up. But again, the safety data looks great. There were no shortcuts. We've had thousands and thousands of people before the medications were approved for the public. And again, just in the US, over 70 million people have been vaccinated. So some of the concerns have to do with people worried about the new technology, the newer technology, the speed of the approval, and just not knowing enough about it. But all of those things are things where programs like this and having the scientists, and I know you've had people from the NIH on, you've had investigators on, you've had community advocates on. That's what's important, for people to hear from the people in the process and answer those questions directly.
Absolutely. So are vaccines, here's a question, are vaccines only way to prevent infection and spread? Or can we just continue to wear masks, wash our hands, and we'll be okay?
We need to continue to wear a mask, wash our hands, and that we need to do, and we need the vaccine. Because we heard about getting to the new normal where we can actually start to do things again. And what's important is that we need to get to a point where the virus needs a host to continue to replicate. It needs to go from one person to the other, right? It needs to be able to keep doing that, to propagate and to replicate. So what we're doing with the masking is kind of a physical barrier. That's why we're doing social distancing, right? So it doesn't get to the next person. Now we're doing the mask. But at some point, the virus is still here. The only way it's going to not be able to take hold in the next person is if you have antibodies. And that's what vaccines do. They give us antibodies so that if you have 10 people and 8 of them have antibodies, the virus, and what the odds, it's just an odds game, right? To be able to get to those 2 people who cannot get vaccinated or who just couldn't get vaccinated. So the more people in the environment or in the community who have antibodies, the less likely that the virus is going to be able to get to somebody who's susceptible to it. So we need the vaccination to get us antibody levels, because natural infection, people will continue to die, right? Not everybody dies, but a lot of people. So we can't say, let's just get everybody natural infection. We need to be able to be immune to the infection by vaccine technology. And in the meantime, and while even after we're vaccinated, to continue to wear a mask and social distance and wash our hands until we get more information about when we can safely not do that.
So there's been some questions, and I've seen them on multiple programs. I've seen them on articles. I've seen, and even in the comment sections tonight, that people are saying it's about vitamin D, and if we take vitamin D, then we will be. The people that are vitamin D deficient are the ones that are getting infected, and we need to take that vitamin D to protect ourselves. And if we take vitamin D, then we won't be infected. So what do you say to those people that are pushing vitamin D as the antidote for being infected by COVID-19?
Yeah. So there's a lot out there, and there's been data around, when you look at people who've had infection with COVID, looking at vitamin D levels, and that vitamin D levels may be lower in people who've had COVID versus those who haven't. But there is no evidence that that is something that is protective against COVID. So obviously vitamin D is fine. Being out in the sunlight is fine. But again, this virus needs to get from one person to the next person. And when it takes hold in that next person with that spike protein, it gets into the cells and starts to replicate. What the antibodies do is to actually prevent that from happening, so that you have natural antibodies, so that if you do get in contact with the virus, it doesn't cause. And we know that these vaccines, 94-95% with Pfizer and Moderna, for preventing severe disease. And even the Johnson & Johnson vaccine, 85% in preventing severe disease. So there are other things people have looked at. And it makes sense when we had for a long time, not even a treatment for people who were sick with COVID. Everyone's trying to figure out what else we can do. And so there've been a lot of things that have come and gone, right? Oh, it's all about zinc. Then it's all about hydroxychloroquine. Then it's all about ivermectin. It's so many things. So again, vitamin D is part of one of the natural vitamins that we should have, and it's in sunlight. And a lot of African Americans may be vitamin D deficient because of our natural sunblock. So vitamin D deficiency is very common. It's also very common in parts of the world where there's not a lot of sun, in cold climates, things like that. And having a vitamin D level that is normal is better than being deficient, but it is not enough to say, I'm taking vitamin D, so I'm going to be immune. We need to do the mask, we need to do social distancing, and when it's your turn, get the vaccination. It's not vitamin D and nothing else, and it's definitely not.
Yeah, I think what we're talking about is that there's not one magic, kind of elixir that we can take to protect us. It's multiple things, and that the vaccine is one kind of piece of that puzzle that'll help protect us all with regards to the vaccine. So,
right.
What are some of those? So when we're talking about in the Black community here, especially in Chicago, what can we do to encourage more Black Americans to get vaccinated, so we can try to get to that new normal that we're talking about? Because don't think I think people don't really recognize that we're not going to get back to the pre-COVID days. I think it's will be here. So there's got to be a new normal established. But how do we get more Black Americans moving on that path to adding all those pieces to the puzzle to get to that new normal?
So that new normal. And that's really important. I think it's going to take a couple of things. One of it is kind of looking ahead as to where you want to be a couple of months from now, later in the year. How do you want to be able to be around people again in terms of the way we like to do that? And I know there's been a lot, I heard the data that, 1 in 10 Chicagoans been vaccinated, 1 in 4 over 65, but you also started the broadcast by saying that, 5.5% of Blacks in Chicago had 2 doses yet. That's obviously clearly a lower number than the proportion of Blacks living in Chicago. So clearly there's a disparity in that. And is that due to access? Some of that. Is that due to acceptability? Some of that. Is that due to a whole bunch of other things, right? A lot of interrelated things. So we have to say, how do we get to a point where we are able to do some of the things we couldn't do before? And being able to be vaccinated, how do we increase that number? Is being able to have people understand why the vaccine is necessary, to be able to get antibodies and protective levels, to be able to get them to know how to get access to the vaccine. So I liked how Dr. Robinson talked about different ways people can know when they're on next, how to do that, how to have a credible source. So if you have questions, you have your questions answered in a way that you understand the answer and you believe it. If you're somebody who has gotten vaccinated, talking to your family about it and being open about it. I can't tell you the number of people that said, after I saw a friend of mine post, and people ask, everybody that posts, I got my number 1, number 2, the comments are like, how did you feel? Da, da, da. And people being honest, saying, even on day 2, I had some soreness, I did this, but I took Tylenol, and then posting on day 3, I'm here, I didn't grow horns, I'm this. There's nothing as powerful as people seeing somebody they know do okay with something. And I would encourage people to say, prior to approval, there were maybe 70,000 people on both studies on the active arm. Since then, there have been 73 million Americans vaccinated. And from Dr. Robinson's number, about 500,000 people in Chicago. And if we look at your number, 5% of the population, there have been now millions of people, Black people vaccinated. Right. So, there was a wait and see. Some people said, I'm not going to be in month 1. I'm not going to be in month 2. But at some point, you got to say, I need to be part of it. What are your still concerns? The numbers game, now more people are vaccinated. Am I worried about access? Well, now there's more information about where to get access. Am I worried about what that means? So again, the whole goal is for people to see more people that have been vaccinated and see that they're okay. To know that when you get vaccinated, everybody gets a card that allows you to register any side effects you have, just so that the CDC can continue to track if you have any side effects. So it's not like there are things put in place if you've had allergic reactions to make sure that before you leave the clinic, you have to be monitored and things like that. So I think as more people share their experiences, as there's more information about where to get the vaccine, how the process is, I think more and more people will get comfortable, because that's going to be important, that the disparity does not continue to expand.
Well, I could talk to you all day, and I hope you can stick around to our Q&A section, because I really want to talk during that time and ask some questions and help our audience understand about how the immune system responds to vaccines while we're doing it. So, and I know you've got some great information to share about that, but I think we're going to move on to our program and we'll come back to a Q&A. So thank you, and we'll talk to you later.
Good. Sure, sounds good.
All right. So at this time, I want to take a break before we talk to our next guest, who's Dr. McAdoo, and he's going to really kind of help us understand, how COVID is really affecting our community. But first, I'd like to really talk about what we're doing at blackdoctor.org. And one of those things we have created on our website is called the COVID-19 Resource Center. And that Resource Center, I'm going to pull the page up here. So this COVID-19 Resource Center is a repository of articles, videos, and anything you would need to know or you would like to know about the COVID vaccine, the vaccine rollout. We have specific to cities and states, as you can see here. We've got Illinois there as well. We've got California. We've got different specific states, so you can get information about what's happening in your state if you're not just in the Chicago area. We also have the latest COVID news in a general sense. So those people that were asking about vitamin D, if you view all of our posts, there are some articles in there about vitamin D deficiency and how it has played a role into really about how it affects when people of color get infected with COVID-19. It really kind of talks about that. And then we also have here, we've got the statistics, and you can see in terms of the deaths by race or ethnicity, and you can see that even though we are a smaller percentage of the population, we are a higher percentage of the deaths that have been associated with COVID-19. And so it is, again, we've had the top experts from around the nation, as we had Dr. Nunes Smith earlier, we've had Dr. Fauci, Dr. Corbett, who was instrumental in developing the Moderna vaccine. So this COVID-19 Resource Center on blackdoctor.org. Just go to the site and you see right here, you would just click right here on COVID-19 and you can visit our Resource Center. You can visit it daily because, again, we post articles daily on our site to to give you all the information you need to make an informed decision about COVID and the vaccine. Our next guest here is Dr. Efren McAdoo, and he is an emergency room physician here in the Chicago area. Dr. McAdoo, welcome to our discussion.
Thank you for having me. I appreciate it.
Thank you for coming in. I know it's a special day for you. It's your son's birthday, so I want to say happy birthday here, and we're not going to keep your dad too long, so you can enjoy your son's birthday. So, Dr. McAdoo, there's been such a focus on the vaccine for people who don't have COVID. Right. What are the current treatments for people who do contract COVID-19?
Good question. In the emergency department, we have really come a long way with this pandemic. And I'll say that, in the ED, we're treating people with mild, moderate, and severe disease. And so depending on the presentation largely dictates how we respond in emergency medicine. It's important to know for the majority of people that have mild disease, they will recover at home with what we call conservative measures. That is making rest a priority, hydration or drinking fluids is a priority, pain relievers, fever reducers, and some people may require an inhaler or a cough suppressant. So I think that's important to mention. However, there's been a lot of research that's been done across the spectrum of the pandemic. And so we have things at our disposal that we can use for people that may have some mild or moderate disease that are at extremes of age and that may have comorbidities such as heart disease, kidney disease, which is a big part of our community, which are monoclonal antibodies. And those monoclonal antibodies can be used to treat people and send home. It has been shown to be effective for people that don't require hospitalization, and it's been shown to reduce readmission rates and hospitalization. So those are some of the things that we have in our armamentarium. And then lastly, again, we've come a long way. At the beginning of the pandemic, we saw people that required ventilatory support, oxygenation, methods of ventilation, methods of pretty significant oxygenation, and lastly, mechanical ventilation. But now we've come up with antivirals, steroids, monoclonal and convalescent antibodies that can help those people that are having severe presentations.
So those people that have severe presentations, what are some of the best medicines available to treat those patients?
That's a great question. We are continuing to evolve. We are treating and studying simultaneously at this point. Again, if you are someone that has got mild or moderate disease with comorbidities, and we have, stable vital signs, and we feel that there's a potentially you can be discharged, monoclonal antibodies is a great alternative. If you're requiring oxygen and admission, steroids can be very beneficial for people. And then for people with, again, severe disease, we were intubating very early on rather quickly, but we took a step back and we felt that non-invasive methods of oxygenation and ventilation were beneficial to patients, along with monoclonal convalescent antibodies and then antivirals. So when you say the best, I think it all depends on their presentation. And we will continue to evolve and get better like we have.
Right, right. So what are some questions that people should be asking their providers to ensure that the best care and medicines are available? I guess really, what are some things that people can ask doctors, especially if they present to the emergency room, that can help them be their own best advocate?
I think, if I may, I want to back up to say, what are some things that would, if you develop, would require you to seek medical attention? I think it's very important for people to recognize signs and symptoms and when to seek out emergency care. So if you're developing any chest pain, if you are developing any shortness of breath, if you are developing any confusion or new confusion or altered mental status, if you have mild to moderate disease or symptoms and you know that you are at risk because you have comorbidities, those are some important things to ask your primary care provider. Also, it's important to ask, what are treatment options? If I show up to the emergency department or if I show up to your office, what are options for me? So I think it's important for people to know that we are treating people outpatient. We have monoclonal antibodies. They can come in, they can get an IV infusion. We'll observe them for an hour and then they can be discharged. And I think it's important for people to know about the vaccine and when they can get the vaccine. So all those things are very important questions to ask.
So, we're here at blackdoctor.org. We're all about trying to eliminate healthcare disparities, and we know that there exists across the board. Right. So, have you seen any disparities in treatments of Black or white patients presenting with COVID-19 symptoms?
We're treating all comers the same, whether you're Black, white, Asian, everyone. There is a standard. Many facilities that I work at have protocols for treatment. But I think we understood very early that the disparities directly affect outcome. And so we take that into effect. There are many people that may not have a patient-centered home, a medical physician. We want to make sure that everybody has appropriate follow-up so that if they need to come back, if they initially were, had mild symptoms and progressed to moderate or severe, they would have someone watching them to say, yeah, I think it's time for you to go back to the emergency department or hospital. If they have, if affordability of certain medications is an issue, we want to make sure that they have that follow-up. And also we want to make sure that people are taking care of their chronic comorbidities, because if those continue to deteriorate, then your outcomes are going to be worse. So, while the treatment is the same, we try to be very impactful by getting people that need it to most where they need to be. And if we can be that, sounding board or that, crutch to assist, then that's what we're doing.
Absolutely. So it's my understanding that you're participating in vaccinating essential workers in the Oak Park area there in Chicago. What made you decide to participate in that project?
I wanted to be a part of the solution, and I wanted to help to mitigate the spread of COVID-19. I wanted us to get back to that new norm, the togetherness, the family time, getting back with friends. Also me as an African-American man standing in front of people that look like me and saying, not only did I receive it, I'm here to volunteer my time to make sure that you get what you need. And if you have any questions or concerns, feel comfortable, because I look like you. I can galvanize maybe some of the things that are out there and also dispel some of the misinformation that's out there.
Absolutely, absolutely. And we appreciate you being out there on the front lines, and appreciate you coming here and standing up for Black Americans and saying, hey, look, I'm here in the Chicago area, and we're not treating anybody any different, but we understand that there's some cultural kind of competition
no doubt,
that needs to happen in order for Black Americans to get the right information and get the information that's going to be life-saving. Potentially for a lot of people. So again, thank you, Dr. McAdoo. I'm gonna let you go and spend some time with your family on your child's birthday. Again, happy birthday, and thank you for joining us tonight.
Thank you very much for having me. Take care. Be well.
Well, our final guest before we go to our Q&A session this evening is Ben Lefevre, and I want to really kind of talk about he is the founder and CEO of a company called CertainTel. And what CertainTel is, and I'm gonna let him tell it because he tells it better than I can because it's his company. But CertainTel is a telehealth, telemedicine program. But it's not, I think a lot of times, Ben, when you hear telehealth, telemedicine, you think of like what we're doing here. We're sitting in front of a computer and we're talking to a doctor, and then our prescription gets emailed to our pharmacist, and then we're good. So talk to us about how CertainTel is different with regards to telehealth and telemedicine.
Yeah, absolutely. Certainly we do a lot of that, Ellis, in regards to the technology to be able to provide tools that make it easy for clinical teams and patients to connect. And I heard a lot of themes early on around education, reaching out to folks that are higher risk. And so certainly by allowing patients to be connected to where they are with their care team. But that's the key of it, is not just the technology, but it's also culturally competent providers that understand a lot of the social barriers that patients of color have in underserved communities around access to care, trust in the health system, all of that. And so, we take technology as a core component, video, we focus on high risk patients, communities of color that have chronic disease, using technologies like connected devices, blood pressure cuffs, glucometers to get data real time to change. But you take the technology and you couple that with culturally competent providers that understand the barriers that patients in underserved and communities of color go through to get healthcare. And the core of what we do, Ellis, outside of the clinical oversight is, we have a network of what we call culturally competent clinical health coaches. They're behavior change specialists. So, how we drive our model engagement is that we partner with community-based organizations that are in the communities. For example, community health centers through the great work of the Illinois Primary Healthcare Association. These are unbelievable organizations that provide comprehensive primary care. They're patient-centered medical homes. But when it comes to high-risk chronic patients and a lot of others, they're spread thin to be able to spend as much time as they need to. So we're essentially a virtual extension of these organizations that are doing the best they can to serve low-income patients. And then we kind of come in and zero in on the high-risk patients, and we do it and deliver the engagement via telehealth.
So that's wonderful. I think so. I guess my next question is, how important is it that underserved populations get access and receive quality medical care and services?
I think Dr. Robinson, Dr. McAdoo, all the unbelievable clinicians really touched on the importance of it. But one of the key ones too is particularly patients, because of the socioeconomic status, have a higher risk of chronic disease, comorbidities, all of that are at higher risk of mortality, if they're infected with COVID-19. And so it's super important to continue to drive education, which is a theme, across this panel today. But what are tools to help touch the patients where they are? And that's really where telehealth comes into play. Most patients, certainly have, a connected device to be able to connect with family and loved ones. How can we use those devices to engage them more frequently, to educate them on what COVID, the vaccine is all about, what it's not about, from what they hear on social media and the like, which your panel has done a great job, describing. And so it's certainly important in underserved minorities with higher risk and higher chronic disease, all of that, to get vaccinated as well. But the way you do that is education. The way you educate is continue to have touch points with providers and clinical staff that patients trust.
So do you work with insurance, or are you charging people? Like, how are people getting access to your services?
Yeah, so we do it two ways. We build our model and focus, again, underserved. So the best way to do that is to reach out and engage with community-based organizations that already are trying to do yeoman's work in regards to health inequities and access to healthcare and the like. And so, but we also have our virtual practice that's credentialed with payers, Medicare, Medicaid, to also provide coverage and services around chronic disease management and others. But our core focus, Ellis, is working with great organizations that are spread thin, for us to come in there and support their overall goals and aspirations of engaging their high-risk patients and getting them well. And like I said, we were able to support patients with a certified health coach that's gone through a lot of culturally competent training, education, to be behavior change specialists. So when the patient kind of says, "Hey, I heard about this," or "I'm not doing this," to be able to understand, not scold the patient, but understand and listen and break down some of those barriers and ask the right questions around why they feel that way, to make a connection, to make a difference in the behavior change, and ultimately, as everyone said, get vaccinated to do that. And the other key area that's talked about is helping patients know where the resources are to make it happen. So certainly you can put out a website or do different things, but there's nothing that beats better communication with a trusted provider that the patient trusts, that can, at the time of a video call or what have you, help them navigate to where they need to go, where they need to be in regards to get vaccinated and the like. And that's a lot of what we do is help these patients find these community-based resources that are really put together well, for example, in Chicago.
Well, that's wonderful. And it sounds like in a sense that you are a kind of a organized healthcare advocates for our community. And so that's a wonderful thing. So are you located, in the Chicago and Illinois area? Where are you located, and how can our audience get in contact with you if they need to utilize your services for themselves or for a family member?
Absolutely. They can go to CertainTell, CertainTell.com. But again, we're a virtual organization. So again, what we do is take what we do well and partnership with these organizations and bring our team in a virtual care environment to make an impact. So we're all over the country. But again, one of the organizations that we have a great relationship with that does great work is the Illinois Primary Healthcare Association. And they are the network for community health centers, federally qualified health centers that do an amazing job and at the front lines of COVID-19 and vaccination. And so those are great organizations that we partner with today to support what they do all the time in the Chicago area.
Absolutely. Well, thank you for joining us this evening. Good luck to you, and thank you for the work that you're doing in getting the information out to our community and helping people get well and stay off of the comorbid conditions. I think we've focused a lot on COVID so much that we've kind of forgotten about those conditions that have really impacted and really have amplified the effects of COVID because we're not taking care of it. And so thank you for the work that you're doing in our communities to keep people healthy.
Absolutely. Thanks, Ellis.
Take care. So as we're we've gone through all our guests, and so I know there's been a lot of questions. There's been some really interesting banter going on both YouTube and Facebook. But I really would like to bring back Dr. Falusi and Dr. Robinson to answer some of your questions. And so if you have some questions right now, go ahead and put them in the comment section so we can ask our questions of our experts. We're not going to take too much more of the time, but we're going to have a few questions. But one of the things that I noticed in the chat room is that they have been talking about how vaccines work, right? And what they do to the immune system. All right. And so there's been some concerns expressed about what vaccines do to the immune systems. And there have been some questions as to why we have to have 2 shots versus 1. So I'll throw that out there, and either one of you can kind of take that answer, or both of you, and give us both perspectives on why do we need 2 shots, and why, and how do vaccines help us in our immune system process.
So I can start, and then Dr. Robinson. Hi, Dr. Robinson. Good to see you. So I mean, the short answer is literally what vaccines do is help our immune system make antibodies, regardless of what type of vaccine we're talking about. Literally, what we're doing is making antibodies so that when we get exposed to whatever that pathogen is, our body is prepared to fight it. And vaccines are depending on what the pathogen is and how your immune system responds to it. That's why vaccinations are very different. So if we recall, you know, when we're looking at hepatitis B vaccine, we have to do, for hepatitis B, we have to do 3 shots, you know, at beginning, 1 month later, 6 months later, right? When babies were getting their MMR, there were series in place. Some things like tetanus vaccines is once every 10 years, right? Some things are like 1 month and 6 months apart. HPV vaccines. So a lot of stuff around vaccines have to do with what we know about the virus or the pathogen, how it interacts with the immune system, and when you do get an antibody response, how long that antibody response lasts. And that's why some things we can do every 10 years and just get a booster in 10 years. Some things we have to do 0, 1, and 6. Some things we have to do every couple of years. Some things like the flu shot we have to do every year. A lot of it has to do with that. Bottom line is you need to know enough about the virus and what happens after you develop immunity, how long the immunity lasts to be able to decide that. And even within the COVID space, right? The first 2 vaccines, the Pfizer and the Moderna, based on how they act, what we do is prime the immune system and then boost it with a second dose. And that's why that prime boost, right? For Pfizer, 21 days later, for Moderna, 28 days later. The Johnson & Johnson, because of the different mechanism of action, requires just 1. Some of the other things in development are just 1. So a lot of it has to do with the technology and how that it interacts with the immune system. And the other part is that for these Pfizer and Moderna, what we think that second boost does is also allows us to go, without getting too technical, there's what we call the humoral or B cell immunity. That's that initial response. And then the longer response is from our T cells. Those are more of our memory cells, right? And those are the ones that could stay longer. And that's why we think that you need that prime and boost, because you activate those T cells, which you don't necessarily activate with the first vaccine. So bottom line is antibodies are what vaccines do to prepare us when we get exposed to whatever that offending pathogen is. And depending on how the virus interacts with the immune system and how exuberant or how huge that immune response is, allows us to either vaccinate in a short frequency, longer term, and things like that. So that's why some are 2 shots, some are 1 shot, some are very often, some are once every 10 years. Every virus is different. Every immune system response is different. And that's kind of the long and short, you know, why.
Dr. Robinson, do you have anything you want to add to the TED Talk about vaccines?
Yes, no, not much to add there. That's exactly the point. You know, that first shot kind of acts as the primer, the second shot is the booster, and adds additional protection. Increased efficacy is what we call it. And there's been studies that kind of study, you know, how much protection do you get after 1 dose and how much protection you get after 2 doses. And so that's 2 doses is really helping you maximize the protection you get from that vaccine.
Well, here's a question. I'm going to put this on the screen from Andre. He says, why do we need a shot for that natural process to take place?
Well, I think it's important to note that when you're getting the vaccine, there's a difference between getting the vaccine and getting the virus. When you get the virus, you don't know how that virus is going to affect you. To have immunity to the virus, you know, you have to risk getting the virus, and then you have to risk all the symptoms that come along with it. You got to risk, you know, potentially being hospitalized. You got to risk potentially, you know, being worsening or even worse. You know, you could put some people died from this virus, you know. And so when you risk getting the virus to get that immunity, you're risking all of the symptoms, all of the side effects, and all of the consequences that can come along with getting that virus. When you get the vaccine, what you're doing is you're getting that same immune protection. Your body is making the antibodies against that virus without risking those side effects that can come along with it, without risking the illness, without risking the hospitalization, without risking potential ICU stays, without risking the potential death from the virus. And so to really get that response and to get immune to that virus in particular, you have to be exposed one way or the other. And so the vaccine is the safer route to get that immunity than the virus.
Yes.
Absolutely. So, Dr. Toyin, there has been an ongoing debate in the comments section about mRNA technology. Could you explain that a little bit more with regards so our audience can kind of get an understanding of what the technology is, how long it's been around, and is it safe or not?
Correct. So mRNA technology is what's being used in the Pfizer and Moderna vaccines. The initial technology was developed in the 90s. So we're talking 2 decades. And over in around middle of 2000, about 2005, the technology was refined. And really the technology is what it is to be able to, the messenger RNAs, and the RNAs are the proteins in our cells that allow the RNAs allow us to make proteins. That proteins are what we need, right? And the RNA, a lot of people worry about, oh my gosh, is this mRNA technology going to get into my DNA and change my DNA? It doesn't do that. So this technology allows, and the reason why people say, well, why wasn't it being used before? So it's been looked at in certain vaccines. They've tried to look at it for Ebola, for flu, and the technology was looking at being refined, but it's a very short-acting protein. It's short-acting. It needed to be able to get to the cell to need what it needs to do and not be destroyed before it gets to where it needs to get to. So it's really packaged in a small fat bubble. So when people talk about nanoparticles, they're like, what's nano? Is that like, a code for something? It's really in a fat bubble to get it to where it needs to get to. And then it actually allows the body to start making the protein, which is the spike protein that the virus uses to attach to the cells. So the body now makes the spike proteins without you having to get the natural infection like Dr. Robinson talked about. And so your body makes antibodies to this spike protein. So this mRNA technology has been around for a while. It's been refined since the middle of 2000s. It's been tried and looked at for other types of diseases. It's been looked at for even in cancer technology. This is the first time it's been successful all the way to be able to look at it in vaccine technology, which is why people are worried about it. But there's been a lot of work that's been done for the last 2 decades in this area. And with all the information that was available, and now when COVID hit, and this was our biggest public health crisis of the century, everyone was really working on the same issue. And so what we know about it does not go into the DNA, doesn't go into the nucleus, does not integrate into your DNA. It makes the protein, it's very rapidly degradable, and then it makes those spike proteins that allows the body to then form antibodies to that. But I do think that because this is the first mRNA technology type vaccine is why there's been a lot of concern.
Absolutely. Dr. Robinson, I want to really help the people in Chicago, and I want you mentioned it earlier, but I want to reiterate it here at the end of the program in terms of how can Black Chicagoans or any Chicagoan get the vaccine if they want to get it, if they're on the schedule. I know you're probably following the CDC schedule, but if they're on schedule, or can they get on the schedule early? What can they do if they want to get the vaccine?
Yeah, so absolutely. Great point, and great to bring it up again. I think, things that people can do if they want to get the vaccine. First, figure out where you are in line. And to do that, we have on our website for the city of Chicago, it's chicago.gov/COVID-VAX, the different phases of vaccination and where we are as a city. Also on that website, you can find ways that you can be updated, get updates about the vaccine, registering for our Shy COVID coach, and you'll get updates about the vaccine here in the city of Chicago. Or you can sign up for ZocDoc. Now, ZocDoc is an appointment system. They'll ask you some questions initially to kind of figure out where you are in line, which phase, as we call it, of vaccination do you fit into. And then you can see appointments, and you can also be notified when new appointments become available. Also on the website, we have links to pharmacies and making sure that you check with your providers to see if they have the vaccine when it's your turn to be vaccinated. But most importantly, you know, like I mentioned before, right now, our supply is just not as high as our demand. We have a high demand for the vaccine right now. A lot of people want it, and so we are really urging patients. There are 700,000 people in this current phase of vaccination, and we're getting about 6,000 doses of vaccine a day to spread over the entire city. So it's going to take us some time to work through that group. So we also urge patience while people wait. And while you're waiting, the last thing, get information, get your questions answered.
Absolutely.
Also on the Chicago Department of Public Health website, we have answers to kind of some of the most common things we hear about, rumors and misinformation that people have about the vaccine, and we address them there on the website. And if you have things that you don't see addressed, let us know. We'll address those too.
Absolutely, absolutely. Well, thank you for that. I wanted to make sure that we get that information out because we want to get the information about the vaccine. We want to talk about COVID and really how to protect ourselves, but we also want to give people the right information so that if they do want the vaccine, because I know there's some people, I've seen some of these comments, there are people in here that don't want it, and that's fine. That's fine. That's their decision. But there are a great number of people who do, and they want to be able to get the right information on how to get vaccinated. So thank you again for sharing that. As we're wrapping up, because we're over our allotted time, so I'm going to let Dr. Toyin, you kind of make a final statement, and then Dr. Robinson will make a final statement, and we can get out of here.
Okay. I would just say for anyone who's joined and has continued to join, that it's important to seek out information, look for credible sources, visit the resource website for Black Doctor, and really just have your questions answered. And for those of us who are in the healthcare field and part of the message giving, to listen to learn. And I like what was talking, we really need to listen to people's concerns, address those, I give them information that they need, and not discount people's fears, but also saying that this is how you can access the information, and this is the information to make that informed decision. So educating, and I do think that whatever we learn from this process, we cannot unlearn. So whatever partnerships are formed, whatever we do around telehealth, whatever we do around dissemination of information is going to help in managing high blood pressure and diabetes and asthma and all the things that are where we have disparities in the city of Chicago. So I think, you know, while this is what caused this to happen, I think the information around who's giving the message, how we give the message, how often we give the message, how we receive feedback, and how we share best practices is going to help us. It can only make things better. And I think that's what I would say. And that natural infection, while there are going to be people who will get infected, and you know, Dr. McAdoo did an excellent job in all the treatment and advances, there are complications where we're seeing now people who have COVID and long-term complications that we're seeing. So again, the vaccine is the way to go. That, I mean, people kind of think, well, if I don't die from COVID, that's fine. What we know is that there might be chronic conditions in terms of lung disease and fatigue and even, you know, memory and things like that that may happen, this long haul effect. So the vaccine is a predictable way to know, you know, antibody response. We're going to monitor the safety data. And I would just say that, you know, just do it. I've gotten vaccinated, and I will continue to talk about that and hope that, you know, even if one person changes their mind with information and they can share that with somebody else, that we just can keep the message going. I know it was lengthy closing, but
it's your close. It was your close. I can't tell you how to do your close.
Our panelists brought it, and everyone just kind of, it was great.
Wonderful. Dr. Robinson.
Yeah, I will echo some of the same things. You know, everybody just seek out information, get the facts, get your questions answered about this vaccine. So when it's your turn, you are ready to get that protection and to protect yourself, your family, and your community. You know, we have all been in this COVID tunnel for a while, and I know we are all ready to come out on the other side. And this vaccine is one of those tools that will help us do that. In addition, while we're waiting, everybody continue to wear your mask over your nose and mouth, over both.
Yes.
See a lot of masks not over nose. Continue to wash your hands, continue to social distance. And we will continue to work here in Chicago to get this vaccine out as efficiently and as equitably as we possibly can. And we can all do our part to protect Chicago and come out on the other side.
Well, I just Absolutely. I want to thank you, Dr. Robinson, for coming on and joining us tonight and representing the city of Chicago and the Department of Public Health. You're doing a wonderful job and continue to try to educate and inform and vaccinate as many people as quickly as possible. I also want to take this opportunity to thank all of our guests for joining us today. Dr. McAdoo was wonderful. Ben Lefevre kind of talking about community advocacy and connecting with community-based organizations to get information out to patients and talk about not only just about COVID, but about other health conditions as well, especially in our community. We have to understand that we need to take our own responsibility. We need to take our personal responsibility to be informed and then inform those around us, inform our loved ones, our friends, our families, our neighbors, to get them the right information. There's a lot of information. The internet has a wealth of information, and some of it is not good. And so we had to make sure that we have some trusted sources. And so that's why I would say, hey, come to BDO, go to our COVID Resource Center, go to the city of Chicago. They've got a wonderful COVID Resource Center to learn more about what's going on about the vaccine so you can get all the information you can to your friends and family. Again, I just want to thank everybody for joining us tonight. I'm even going to thank the people that had this spirited discussions in the chat room and in the comment section. It really, and I'm going to speak candidly and off the cuff. I want to say that those type of discussions help drive our content on BlackDoctor.org because we have to address those concerns. We cannot leave those concerns out there, hanging out there because they feel like, oh, they're not listening. They just want to continue to push a narrative. No, there are some things we want to get the right information out there to you, and we're going to address as many concerns as possible so we can get the right information to everybody so we can all stay safe. Our number one goal is to save lives, and whatever we can do to continue to do that and then close that life expectancy gap between Black and white Americans. And so we're going to continue to do that as our mission, and whatever we can do, have these type of panels, have these wonderful type of guests here with us. We're going to continue to do that. So thank you all again for joining us, and we'll look forward to our next series. And we've got a lot of cities that we're going to do across the country because African Americans tend to live in metropolitan areas. And so we're going to touch all of the metropolitan areas across the country and touch on how they are attacking COVID and getting the vaccine rolled out to everyone. So again, thank you all for joining us this evening, and we will see you next time.
Great. Thank you.